Okay, I think we're going to get started. I'd like to call to order this meeting of the Assembly Public Health and Safety Committee. It is December 4th at 11 a.m. And let's start by calling roll. Why don't we always start on the phone? Looks like Mr. Salt, are you here?
Yes, Randy's here.
Great. And Ms. Brawley?
Hi, I'm here.
Thanks. And then let's go ahead and go around.
Mark Littlefield.
Karen Bronga.
Scott Myers.
Cameron Perez Verdilla. Okay, we have a full agenda today. Just as a reminder of those on the phone, if you want to get in the queue, just send me a text. I'll keep my phone ready to go so I can see that. And if there's anything else, let's just go ahead and start with the Department of Health. Director Rash, welcome. Officially, Director Rash.
Thank you so much.
Yep.
All right. Today, I'm going to be talking about a annual appropriation that the Health Department receives from the state of Alaska, and it is called TUP, which is Teen Unintended Pregnancy Program. It is a program that is run out of our clinic and clinical services. We have one staff member that is dedicated to this work. And this individual has been doing this work for many years at the health department. So it's really exciting that I get to talk about it today. So the mission of TUP is to focus on youth education around topics like birth control, sexually transmitted infections, proper condom use, consent, and healthy relationships. TUP funds are provided to AHD to prevent and reduce the incidence of teen and unintended pregnancies through education and promoting long-acting reversible contraceptives. AHD has been actively working to equip young people in the municipality with their knowledge and resources they need to make informed decisions about their reproductive health. We provide evidence-based education on birth control methods, healthy relationships, and preventing sexually transmitted infections. Some of the goals that we have within this program, and they're aligned to the state goals of Healthy Alaskans 2030. Under Goal 19, which is to increase the number of high school students that graduate within 4 years of starting 9th grade. Goal 11 of reducing the incidence of gonorrhea. And Goal 17, which is to increase the number of adolescents with 3 or more adults besides their parents that they feel comfortable seeking help from. The goals that we additionally have within our clinic is to increase the number of Anchorage adolescents aged 10 to 25 who have received medically and factually accurate education for the prevention of pregnancies, STIs, and unhealthy personal and digital relationships. Another goal is to increase participants' knowledge, attitudes, confidence, and intentions to practice safer sex practices around unplanned pregnancy, STIs, HIV, digital safety, and healthy relationships through skills and role-playing activities. We also want to increase the number of adolescents aged 10 to 25 who are linked to youth-friendly clinical sexual health and interpersonal violence prevention services through referrals, education, and young adult-focused community outreaches, offering resources and condoms, as well as parent education resources to facilitate communicating about sexual health topics with their youth. The impact so far within the municipality is that this year in 2024, we have reached nearly 500 members of the target population since July through a combination of school-based workshops, community outreach, and digital resources. These numbers include attendees from 37 presentations between 6 ASD schools and various community centers such as the Power Center, Alaska Child and Family, and OCS. We have continued to build strong partnerships with ASD and community partners, as well as referring clients to Clinical Services Division at AHD for free or low-cost pregnancy tests, STI tests, and birth control devices. Birth control devices offered at the health department for members of the target population are provided by the TUP grant and include long-acting reversible contraceptives such as intrauterine devices and implants. We focus on healthy relationships, so our TUP grant activities include teaching members of the target population skills relating to communication, consent, respect, and understanding boundaries using the HEART, which is the Healthy, Empowered, and Responsible Teens program. So overall, we really want to aim to remain committed to improving the program by exploring new partnerships with community organizations and training more staff to provide these resources. We are strengthening our data collection and evaluation methods to ensure that we are reaching the target population who are most vulnerable to unintended pregnancies. And we also want to continue to fill gaps in teen sexual education with evidence-based informed or information presented in a non-judgmental, thought-provoking way, and provide birth control options for those who may not be able to reach those resources elsewhere. And so this item will be coming to your attention on the 17th agenda. And that's it, sorry. Any questions?
Great. Yes, Ms. Bronco.
So I heard you say that you went to 6 schools. I imagine it was high schools or not?
Middle schools and high schools.
Middle schools and high school. And then you talked a couple times about target population. Can you tell us how you identify which students that you're going to be doing this work with?
So the employee actually works with ASD. So the curriculum that is provided is approved by ASD. And so working with the contact there, they actually help us in which schools to go to, as well as which classrooms.
And then are parents able to opt out? I know when I taught elementary health, yeah, okay.
Yes.
Thanks. I have a couple of questions for you. You talked about data. Do you have, one of the things that I'm particularly interested in is what these rates are now, what the teen pregnancy rates are, the STI, STD rates are, and sort of what, if there's any data around sort of what the knowledge base is or awareness base is now, so that we could be looking at the improvement of that. So that's one, is to talk about if you're aware of if that data exists, because I'd be really interested in knowing more about it, to knowing the sort of scope of the challenge and the problem that we're facing. And then the second is, you mentioned that it's a grant. Can you tell us a little bit more about the timing of that grant, and if it's something that is sustainable over a long period of time, or if that's not something that we as a city need to be thinking about? If the grant's going to end, we need to continue the program.
Yeah, great question. So the grant is runs on the state fiscal year, so from 7/1 to 6/30 of every year. And so once the grant comes to us is then when we obviously move forward with the appropriation process. This grant has been coming to the health department year after year. I don't foresee any major changes coming up, which is great, because again, this grant not only provides birth control devices, but the education piece, as well as the full-time employee. So it does support labor and non-labor. In regards to the scope of the problem and the data, so we do know that Alaska has the highest rates of syphilis within the US. We also know that without this education, I don't know a forum where we could provide that elsewhere. From 23 to 24, the incidence of pregnancies have decreased from 23 to 20 births per 1,000 females aged 15 to 19. And so those are some Anchorage stats, but other stats I'd have to get back with you about.
And I don't see any additional questions for you. So thank you so much for the information, and thanks for sharing about this important program.
Thank you.
Okay, next up on our agenda, we have the Anchorage Police Department. You want to come up? If you could introduce yourself for the record and begin your report.
Good morning. My name is Gina Burrington. I am the Deputy Chief of Administration at the Anchorage Police Department. Chief Case is at a training conference today, so I am here with you this morning. He asked me to provide to you an update about Draft 1, which you may remember is the AI technology for report writing that we were testing. We had a 90-day trial of that. We were provided access to that from the company at no charge to test that. We had a number of users across different assignments within the department, and that concluded this week. We no longer have access to this program. The company has terminated our ability to utilize the program, as it was a free trial, and that has since expired. Overall, we did not find the time savings that we were hoping to see. We have provided feedback to the company, which they were very happy to have. They are actively working to improve the product. They said some of the things we had to say were very similar to some other things that they had heard from other departments, and we had some additional feedback that they hadn't heard or hadn't considered. So at this point, we are electing not to move forward with the product. I think we all know AI is a very new and rapidly evolving technology, and we may revisit this in the future as the product improves. But at this point in time, it was not as beneficial for us as we were hoping, and not worth the benefit that we would get is not worth the expense that we would have to lay out. So.
Can you just take a step back for us? I think many of us are familiar with what you're talking about, but can you take a step back and just again explain what this software program does and what you were hoping for it to accomplish?
Yeah. So Draft One is a AI program that works in conjunction with the audio from the body cams that officers are wearing. It takes all of the audio, basically transcribes and understands it, and then the user asks for it to generate a report, and it will generate this program will generate a police report based on the audio from the body cam. The officer then, of course, would need to go in and read it, edit it, verify that the information is correct, add things that they may have seen that they didn't, because it's only working off of the audio. So if they saw something but didn't say it, of course, the body cam isn't going to know that. So they would have to add things, subtract things, make sure that it was accurate and complete and a reflection of what they wanted their report to say. And so that's what that program did. We were hoping that it would be providing significant time savings for our officers, but we did not find that to be the case.
Great. Yep, Ms. Braga.
I had read recently where in the medical settings, they're finding that there's these ghost transmit, that it invents things. Do you know if the officer saw any of that where the AI put in scenarios that weren't?
I do not believe that we saw it putting things in there that didn't happen.
Okay.
Or that weren't necessarily accurate. It put things that were unnecessary, and sometimes it would include things that shouldn't be included. Like, for example, if an officer is in the hospital and like they're in a hospital room or a treatment room, like there might be a lot of conversation occurring that certainly does not belong in a police report that the AI might generate that the officer would then have to remove. So, but I did not hear any complaints of it just like making things up that didn't happen.
Thank you. Thank you for your report. Appreciate it. And just for the record, we've been joined by Mr. Johnson and Mr. Rivera. Okay, we're moving along. Do we have someone here from the Anchorage Fire Department? You guys want to come up? I don't have any topics listed on here, but I think you may have a report you want to give. Is that correct? Okay, so you have a report. Okay, well then you guys can sit down. We've got a lot of other things we want to get through. I want to make sure that there's an opportunity though. So anybody from the Department of Law, I think aside from the municipal attorney, is there anything separate? I think we could probably add it to when the municipal attorney's up. But and then the Office of Emergency Management, is Amanda here today? I don't believe so. Okay, cool. We're going to move right on in, I think, to the mayor's office. Is my microphone skipping out? Is it? Okay. It may be because I'm touching it. How's it now? No? Okay. All right. I'm going to switch. Great. Thanks. Okay. Mayor's office. Why don't you guys come up? I think we have Mr. Wheeler and Miss Gardner and Miss Agnew-Benben coming up. think we might need a third microphone for you guys. Okay, all right. Welcome. Thank you for being here. Okay, we've got 3 items on here. Do you care how we start? Do you want to start, Mr. Wheeler?
That would be fine,
So
sir.
thank you for being here.
Thank you.
Appreciate it. If you'd introduce yourself for the record and go ahead and give us a prosecution update.
Thank you. Through the chair, my name is Dennis Wheeler. I'm the Anchorage Municipal Prosecutor. I've been on the job for a month and a half or so, since October 7, coming in to help resolve a lot of issues in prosecution, dealing with systems and operations and short staffing and backlog of cases left over from the COVID days and so on and so forth, which I think most of you have been aware of and we've reported on earlier. So the update is
A
that
little bit closer.
we're making progress on staffing, at least with respect to support staff. I may potentially be full on the support staff side by the end of the year. I've got some interviews and so on to go through. So they're looking okay there. But we're still short 5 of 15 attorneys, which really hampers our ability to move forward on the backlog. I've been very fortunate to have a number of folks step up to help, as I reported last time, including the state DA's office being prepared to handle cases for us. I've got a couple of volunteer retired attorneys that have come in and screening cases. I've got 2 more under contract providing services, actually 3 more providing services under contract. So I've got some placeholders there, but the staffing issue for the attorneys is still the #1 problem to solve, I think, at this point. We are making some system changes that I think are going to help caseloads long-term, including creating what we call blanket offers. These are mandatory minimums for certain qualifying cases so that defendants have an offer to look at earlier in the process, so that cases aren't rolling from calendar to calendar to calendar and clogging up the system. I'm also opening up more opportunities for folks to move into the therapeutic courts, like the vet court, the mental health court, things like this, so that those resources, those treatment programs can be available to more people. The courts have those resources and they've been underutilized more recently by us. So we're trying to step that up, get more people into that queue and out of regular court. And the benefit there for the folks involved is if they perform and complete the programs, they can have their original charges substantially reduced or dismissed, and they get the benefit of resolving their alcohol or drug issue or become more stable if it's a mental health issue. So we're looking forward to putting more people into those programs and see if we can improve the success rate there. That's my report, sir. Thank you.
Yes. Mr. Rivera and then Ms. Bronco.
Yeah, thanks. So you used a buzzword that got my ears. You talked about mandatory minimums. Can you just talk a little bit more about what you mean? And did I?
Sure.
Yeah, thank
through the chair. Thank you. So mandatory minimums are typically state law driven that say if you commit, say, for example, an OUI or DUI offense, the minimum you're going to be sentenced to if you're found guilty or you plead no contest is, say, for example, the 3 days of jail time and the certain minimum fine and probation, et cetera.
Yeah. So I guess what I'm getting at is there going to be a change in policy, or why did you bring mandatory minimums up in this conversation?
Just as an example, we were finding that our offers tended to be a little bit higher than the mandatory minimums. And in some cases, a defendant would be better off going to trial, burning up resources, being found guilty, and still get a better sentence than our original offer that we made at the beginning of the case. So why did we spend all that time and resources on that? We need to make a better offer that comports with what both the judge is likely to give if they're found guilty and what the state was doing. So we were just out of sync. So we're fixing things like that to make the whole process move better.
Got it. Thank you for clarifying.
Bronco?
Thank you. I heard you say mental health court, and was it substance use court, or what was the other?
Yeah, there's a lot of jargon in the court names, so I get them mixed up myself as I'm learning them, but we have a community resources program court called CRP. That's mostly mental health court driven. We have a vet court for veterans. And so we have a few of those kinds of courts. We kind of lump into the category of therapeutic courts.
So I was on a trip to look in Austin and Albuquerque, and then I've been looking into, there's a lot of communities that have a homeless court. And, I was thinking possibly hooking it up with our HEART team, but a service provider would handle the court case. Do you think something like that would be of value? So for instance, if there were park violations, misdemeanors of things going on in the court, instead of bogging you guys down, maybe at the Third Avenue Nav, the court would be held. I don't know. Can you see any value in something like that?
Through the chair, I would be very interested in exploring that idea. I can tell you that a high number of individuals that are in these court programs the state already has are in fact people that have housing issues. And in fact, there are some individuals, I've just seen it firsthand going down to the jail court recently and learning about that, is that there are a number of people that won't even come to the jail court proceeding to get bailed out. They'd rather stay in jail and get the bed and the meal and the et cetera, because there's nowhere else for them to go, really. So it's an interesting issue to look at, yes.
Ms. Gardner, do you want to add?
Thank you. And one other thing to comment on is just the kind of longer term vision for prosecution. Right now, it's still in a stabilizing, rebuilding, restaffing mode, but we're hopeful that phase 2, once we're stabilized, restaffed, rebuilt, we can start looking at interesting, innovative new ways to approach this and take kind of a whole person, right, holistic view of these situations. So exploring new diversionary courts or new diversionary programs, different types of courts. Those are things that we're really excited to look at once we're stabilized and rebuilt.
Thanks. I did want to just dive in a little bit more to the staffing report. So you said that your support staff is almost full, I think is what you said. And then you mentioned that you're still short 5 out of 15 attorneys. Can you give us just a little bit more detail of what who those are, how those attorney mixed are up and sort of the impact of that? Because I'm particularly interested in once we get stable and the time frame for that and what that is going to change as it relates to your ability to do your work.
Thank you, Mr. Chairman. So right now, one of the biggest things that we run into is that there are a number of court proceedings that happen every day, 24/7. So we have people that have to go to the jail court, whether it's weekday, holiday, weekend, and we have out of custody arraignments at court. We have court bail hearings, court change of plea hearings. All those regularly scheduled everyday court hearings, if you will, need to be covered by an attorney. So when we get down to 6 or 7 attorneys, and if somebody's out, somebody's on vacation, sick, whatever, all we're doing is just going to the hearings and tracking what's happening. We're not actually processing the cases or being able to take things to trial. That became a real problem this past summer and into the fall. So we need the attorney numbers to come up to be able to actually resolve the cases, not just take them to hearing, unresolved. So that's the biggest issue, is that you need that minimum staffing just to be able to take things to trial. If you can't take things to trial, the defense bar knows that, and they'll push the cases even harder and move them. And what happens is then what you've seen is a brash of what's called speedy trial failures on our part. If we don't get the people to trial fast enough, those cases have to be dismissed.
And that creates a backlog essentially. And where is that at now? Where is that? I mean, what are those data points that we need to be tracking to know that of whether it's functioning as it should be?
Yeah, so through the chair, we were able to bring in some volunteers. They approached us. And of course, we have a former judge, retired judge, Stephanie Rhodes, and former municipal prosecutor, John McConaughey, et cetera. Really, really high quality folks coming in to help us. And so I expect by the end of the year, I'll have a really good sense of the backlog being resolved up to that point, but understanding those folks are on 6-month arrangements. And so I've got to be able to bring in the attorneys to take over that work as they ease back, because I can't expect people to volunteer forever or work under a contract. They came out to help with the short-term problem. They're not committed to doing something longer term. If they were, I'd probably hire them. But that's really the issue, is
Okay,
being able to
thanks.
carry that case
Thanks.
on.
I don't see any additional questions for you. Thank you for being here and thanks for taking this job. We appreciate it.
Thank you.
Okay, we're going to move on next to Mrs. Gardner. I think you're going to give us an update as well.
Yes, thank you. So I think my update is largely on the APD outside investigations and where those are. So just to recap,
And maybe you could just, for those that may be new, just give us a recap as to, in terms of what you're doing and why you're doing it, and then give us the update. That might be helpful.
sure. After a series of officer-involved shootings, in particular after the August 13th death of Easter Leafa, then the mayor and the chief of police committed to some outside investigations. So one was specific to the August 13th officer-involved shooting, and that was an outside investigator to come in and do what is typically a purely internal review process of that incident. And it's typically a disciplinary internal review process. And another was a broader policy review of APD's use of force de-escalation policies. So on the first one, the incident-specific one, that review has been completed. We cannot, it is still a personnel investigation, so we cannot provide the full report, but there will be public recommendations. So the outside investigator prepared a set of recommendations. They're being kind of finalized into a PDF right now, and those will be made public along with some explanation. And again, there are limits on what we can say about the findings of the investigation, because it is an internal personnel disciplinary matter, but the recommendations themselves in terms of changes to training or policy will be public. And then the other review is the outside policy review, which is much broader, and it will kind of pick up where this left off. And that RFP is being finalized with purchasing now, and we expect to have it publicly posted definitely by the end of the year for the work to start in early 2025.
And is that, and you said, when is that going to be posted, the RFP?
In the next few weeks, by the
Okay.
end of the year.
And can you give us I know we don't have it yet. Generally, what are we looking for? What is that RFP? What is the scope of that?
So that will take a very broad view of all of the inputs that APD officers get when it comes to decisions made regarding use of force de-escalation, and it'll also look at cultural competence and cultural awareness. And so, it will kind of look at all those things. It'll be a 3-phase approach where Thea might be able to describe it. Thea helped me with the RFP, but Thea may be able to describe the phases in more detail in terms of what we anticipate being put out.
Yeah, so the first phase would really be a series of both quantitative and qualitative data gathering and review. So APD already has a lot of data that they can share, and that's actually already been kind of reviewed through these recent reports. And as well as they would engage in a set of interviews with a set of key informants. And then that would be pulled together into a memo that would kind of share some initial findings from that first phase. That would then inform the second phase, which would be to really go through not just the policies that are available to the public, which are online, but also internal APD policies, as well as their training processes. And we've identified in the RFP a pretty lengthy list of areas that they should be reviewing, and they should also be comparing that to best practices in policing from around the country. So it would be kind of taking those first phase findings, marrying that with their review in the second phase of the policies and the training procedures. And then in that third phase, developing a set of recommendations, many of which would be kind of internal recommendations, but also some of them would relate to how APD communicates with the public and engages with the public.
And in the phase 3, was that?
That's the third phase.
That was the
Yeah,
third
that's
phase,
the
okay.
kind of development of the final recommendations. Yeah.
And
And yeah, go
to
ahead.
follow up, and then in terms of work product, it'll be a report. There'll also be, a summary version of the report, and we envision having some public presentations of that.
Right. And just in terms of time frame for the completion, what do you anticipate the final report being done?
The RFP estimates 6 months.
Okay. All right. Any questions at this point? I don't see any. Okay. Yeah, go ahead.
Also, just to be clear kind of about the qualifications that we're looking for someone who's done work with police departments of a similar size and scope to APD, and who've also completed projects of a similar scope. So it's probably going to be an out-of-state person who meets our qualifications. And we have reviewed some similar reports from other jurisdictions and kind of, gathered an idea of some of the experts in the field. So we'll be hoping to kind of make sure that it gets out broadly enough that those folks would know about it.
I don't see any questions on that. Thanks for the update. That's great that that's moving forward. So we anticipate the RFP coming out somewhere in the new year, and then anticipate, yes, RFP coming out in the next two weeks, and then the project starting possibly in the new year, and then going 6 months. Is that okay? Great. Okay. I don't see any other questions on that. Great. Okay, let's move on to our next item. Ms. Benben, you have an update on the mayor's public safety strategy development update.
Yeah. Hi, everyone. I'm Thea Agnew-Benben. I'm one of the special assistants to the mayor. This is going to be a short update because we don't have anything to share with you yet, but just wanted to let you all know that the mayor's asked us to develop a public safety strategy. We, hear a lot from the public on this topic, obviously, and it's one of the mayor's top priorities is that we really improve public safety here in Anchorage. And so we've been doing some interviews with APD, with AFD, with the municipal attorney and prosecutor's office. And so we're working with those departments as well as the municipal manager right now to get a draft together. I've also interviewed Cameron about this as well. So we'll be bringing a draft for your review, hopefully in the next month or so. Yeah.
What is the goal?
The goal is to really articulate there's kind of two goals. The external goal is to really articulate clearly to the public, one, that we're hearing the different concerns and kind of the detail of them, and that we're addressing that through some new actions that we're going to be taking. And then internally, we're gaining agreement around what are the actions that we're taking and what confidence do we have that they'll actually lead to the improvements that we want to see. So there'll be an external facing document that we can communicate broadly with, but that'll be married with a set of projects that we'll be working on internally.
And do you see alignment between that and, for instance, the report that we may receive after the new year and other information that we're learning as we're gathering more and more information about training and those kinds of things? Do you see a relationship there?
For sure. I mean, I think just timing wise, like those recommendations we're not going to have until probably like third quarter of next year. So, but there's definitely already work underway at APD and AFD and new things starting in the new year. So we're certainly not going to wait for that report, but we'll be, working towards it.
Great. Mr. Rivera.
Yeah, thank you. And thank you for the update, Thea. So I guess a few questions from me. You said we a few times. Who is the we that's going to be sort of in control of the document?
Yeah, that's, I think mostly it will be the departments implementing under the supervision of the municipal manager. And the strategy is really the mayor's strategy document to ensure that the mayor's priorities are being worked on and achieved.
Thanks. And then I didn't hear it, but is the health department one of the departments that you interviewed?
Yeah, we actually have some really good discussions starting with the health department around how we can, there's so many things at the health department that are great resources, the public health nursing program, the clinic, of course, the housing and homeless and stuff, but we've covered that in a separate strategy. So yeah.
Great. And then what role do you and the department see in community stakeholders in terms of this strategy? Because you said you're hoping to roll the strategy out in some form in January. So what role do community stakeholders have?
Yeah, I mean, I think we've already been having a lot of conversations with different stakeholder groups. We're meeting with businesses, community councils, faith communities. We are doing that on an ongoing basis. So right now what we're trying to do is really reflect. And obviously we also meet with all of you on the assembly and you're hearing from everybody. So what we're trying to do right now is really make sure that our document reflects the main things that we're hearing over and over again. And so that's kind of the first step, is to marry what we're hearing with the actions that we want to take to address those things. And then I think it will be rolled out through those same channels, through those same meetings that we're already engaging in. So community councils, business groups, folks that come and meet with the mayor directly. Yeah. And we're always, with any of these strategy documents we're making, we're always interested in feedback. That's why we usually have draft plastered across them, is that we're seeing these as living documents that we update.
I don't see any other questions. Thanks. And thanks for being here. There's only one other item that I have that I wanted to bring up under unfinished business, and I don't believe we have any other reports. I wanted to just take a moment of privilege to share with the committee that sort of a reflection on the item that was brought forward related to the budget recently. The item where there was a request, there was a proposal of the assembly to add $75,000 to engage in a public process to really look at what kind of community involvement and oversight could we or should we have here in Anchorage. And it was really an effort to engage in a community process, which relates in some ways to Mr. Rivera's quick question to Ms. Agnew-Benben of what's the public process. And so I just wanted to engage the committee in an update and to see if anybody had any quick questions. I really believe that this committee needs to continue to pursue a public process for identifying what is a process that we can go through to determine meaningful involvement from the community in both involvement and oversight. So it's my intention, and I believe there are other members of the assembly that intend to continue to move forward to look at ways of engaging in that process. So I just wanted to make sure that that was said on the record here, and that I also believe that the narrative around the actions that were proposed on that item, I think were misunderstood in many ways, and I think it's a thoughtful process for us to engage in. So just wanted to put that on the record, and if there is no other business, do I see any other questions or items? We have a very efficient meeting we had today. Thank you all for being here. I appreciate your time. This meeting is adjourned. Oh, wait.
Oh, hold on.
Sorry, I'm second. I do want to make sure I forgot the most important part, and that is public participation. So I apologize. I got ahead of myself.
Cameron?
Yes. And let's start with those on the phone. Is this? I'm sorry. I don't recognize your voice. Is this someone who wants to testify?
Yes, this is Amanda
yes.
Loach.
Right.
I
Okay.
have a really bad echo for some reason.
Okay. Well, I can turn off my mic. But is this Amanda Roach?
This is Amanda Loach from the Office of
Loach,
Emergency
sorry.
Management. I was prepared to brief, but perhaps I missed you
Yes.
calling me.
Yes, I'm happy to give you some time now. We did pass over your section, but I'm happy to give you a few minutes now to go ahead and give an update. Go ahead.
Yes, thank you. I just have a couple brief items. So we do have an item coming to you for appropriation, which I have already brought to you before, a $200,000 emergency management performance grant that supplements the personnel costs for the city for our office. We also have a $103,000 grant, which is coming to you for preparation for a terrorist scenario exercise in June 2025. And also some Anchorage Fire Department radiological hazardous material equipment. I can pause there. I'm still getting a pretty bad echo.
No, I think we heard you pretty clearly. So and when will we be able to see those items?
Okay, one more. And then I have $100,000 for cybersecurity grants. It is to ensure that the Comprehensive Emergency Operations Plan, which is our all hazards promulgated plan, is crosswalked with the planning that the IT department does to increase our cybersecurity for the city. And then last, I have one item that should be coming to you shortly for a capital project. This is an investment in our planning and development of a project, which will be a new emergency operations center facility coupled with a primary 911 dispatch. And the money that will be coming to you is some leftover funds that we have from staff turnover this year. And we are going to put that forward for conceptual drawings for this capital project. And that should be coming to you for the next meeting. And I'm happy to take questions.
Looks like we have no questions. Thank you for your update. We appreciate it.
Thanks for fitting me in.
Yep, of course. Okay, let's move on to audience participation. Let's start with the phone. Is there anybody on the phone who would like to speak?
I'm on the line if you can hear me.
Yep, you can. If you can share your name for the record, and I'll set a timer for 3 minutes. You'll hear the little ding when you're done. Go ahead.
Okay, thank you. Yes, for the record, this is Mercedes Arciniega. I am a resident of West Anchorage. I'm actually really happy with some of the comments I heard today in the committee. Also, there's a really bad echo. With the comments from Mr. Rivera as well as Mr. Perez-Verdia regarding civilian oversight and public participation in the process of law enforcement reform and just public safety at whole. I think, yes, I completely agree that the intentions and the narrative around the proposed budget item was wildly misunderstood. I appreciated the debate that was around it because it gave me and the rest of the community an idea of what people prioritize and what their views are regarding this subject. I just want to echo, though, or what a lot of people have said on this within the community, whether that's on public record or just in conversations around me and my neighbors, that this is not meant to be something that is scary or inflammatory and accusatory. Let's just face it, there has been a rash of events that have happened in this past year that call into question what policies and procedures and training and so many other items that need to be aggressively looked at and aggressively revised. To say that, you know, public participation should be somewhat limited, or we're having certain talks, or, you know, we're establishing this committee and advisory meeting. There's already been plenty of people who've spoken out that's saying that that's clearly not enough. The huge part about what we're talking about in independent review is the civilian oversight part of it. And why would you not want your public to be a part of their democracy, their right to be able to have participation in this process? While in a utopic society, we should be able to trust in our leaders and our you know, legislative representatives to speak on behalf of their constituents, but clearly, and no disrespect to the people who've been serving and who are serving, but that hasn't been enough. And I get it, you have so much on your plate that you have to juggle in terms of prioritizing taking care of this city. But this is something that is frankly a failure, and we need to accept that, and we need to address that. To just be scared of it or to call it something to be just to rip apart an institution and to make it a super negative situation. Why would you not want to continue to improve your department and your policies? Even if we didn't have these issues, why would you not want to be at your very best? While I appreciate what the mayor and the chief have brought to the table and certain assembly members, we're still missing the huge component of civilian participation. There has to be an integration of that. Otherwise, you're missing a huge part of it, and you really need to rebuild your trust in the community. Thank you for letting me speak today.
Thank you for your testimony. Is there anyone else on the phone who'd like to speak at this point?
Hi, this is Vicky with Victims for Justice.
Great. Go ahead and begin. You'll have 3 minutes to share your comments.
I overheard Bimbimix, sorry, I'm not pronouncing it correctly, the policy proposal for public safety for the community. And I wanted to highlight, it's a municipal project called the Alaska Domestic Violence and Sexual Assault Intervention Project. And it's a grant between STAR, Victims for Justice, and Awake. And it's funded to help with referrals from the municipal prosecutor's office so that we can help with with the victims when they need to get relocated or just be able to work with them while the prosecution does its job. And we kind of work with the crime victims to make sure that they're able to attend the court hearings, be available for the court hearings. And this was the last year of that grant and it expires. And although our three partners do get alcohol tax funding, which is wonderful, it is not able to also cover things that were previously covered in the Alaska Domestic Violence and Sexual Assault Intervention Project. And that grant has funding that is that helps us provide direct assistance to victims of violent crime. So we're able to help with, say, if they got their house riddled with bullets, we're able to help relocate them. If there's an arson, we have been able to pull these crime victims out of shelter to help them with funding to get relocated, maybe a hotel for a week, and then use the Violent Crimes Compensation Board, which is the state, to further their funding to get relocated so they're not in shelter. This is a really amazing grant for crime victims in Anchorage, and I really hope that it's renewed, but this is the last year, and I would really encourage you guys to think about it as you think about the public safety planning and policy for the municipality. Thank you for your time.
Thank you for your testimony. Is there anyone else on the phone who'd like to speak at this time? Okay, hearing none. Is there anyone in the audience here in the room that'd like to speak at this time? Yes, come on up. Can we give them a microphone as they come up? Thanks. Probably just sit right there. Yeah, that's a little bit more comfortable. And can the person on the phone please mute as well? We can still hear you. All right, if you would share your name for the record and where you live in Anchorage, and you'll have 3 minutes.
My name is Sasha Kramer. I'm a resident of East Anchorage. Today I came to speak on the proposal to use AI technology to write police reports within APD. I'm glad to hear that APD will not be utilizing this program anytime soon. I do still want to bring your attention to the reasons I oppose the use of generative technology now and in the future. A study conducted by the United Nations Human Rights Office of the High Commissioner confirms that AI technology perpetuates racial discrimination. This report examines 4 cross-cutting ways in which AI can contribute to the manifestation of racial discrimination. That's through data problems, algorithm design issues, the intentionally discriminatory use of AI, and accountability issues. Additionally, there are some concerns from lawyers who are concerned about AI reports in policing and in the court. They are raising concerns over accuracy, transparency, and potential bias, and are concerned that AI reports won't be admissible in court. With all of that in mind, I hope that the Anchorage community will continue to say no to AI technology within policing. I would also like to echo appreciation for the comments made here about public involvement in police accountability. I don't want to place blame on anyone, but I am disappointed that the final report won't be out for another 6 months. The Anchorage community feels deep urgency on this matter, and I would like to feel like that's taken seriously. Thank you.
Thank you for your testimony. Would anybody else like to speak at this time? Right. Any other comments from members? Nope. Okay, now we can officially end the meeting. The meeting is adjourned. Thank you.